If you finish before you even start, you might be facing an issue. Premature ejaculation is a fairly common sexual problem, yet rarely discussed. But why? The truth is, it's natural to feel embarrassed about something like this, so many avoid talking about it, even with friends. In this video, you will learn everything you need to know about premature ejaculation, treatments, tools to control it, and in some cases, even get rid of it once and for all. We will approach this topic with the seriousness and empathy it deserves, providing information and useful tips for those looking to improve the quality of their sex life. Premature ejaculation is one of those subjects everyone has heard of, but few admit to experiencing. In fact, up to 1 in 3 people have faced this issue at some point in their lives. It's important to have realistic expectations. If your partner expects you to last 70 minutes and you last 25, that doesn't necessarily mean you have a problem. That's not premature ejaculation. The medical definition of premature ejaculation is when semen comes out earlier than expected during sexual intercourse. First of all, it's not a cause for concern if it doesn't happen frequently, but for a more accurate diagnosis, it's important to consider a few things before concluding you really have this problem. 1. If you always or almost always ejaculate within 1 to 3 minutes after starting sexual activity. And we're not talking about foreplay here, but penetration. 2. If you never or almost never manage to delay ejaculation during sexual activity. 3. If this frustrates or embarrasses you, causing you to avoid intimacy with anyone. If these situations are common for you, then you may have a problem. Before I tell you how to resolve this, I want to let you know that there's a method created by US doctors in the first link in the comments that teaches you how to end all of this without needing to visit any doctor's office. I invite you to check it out. A common question is, are you born with premature ejaculation or is it a medical condition? There are some medical conditions that can contribute to premature ejaculation, such as prostate inflammation, rapid drop in testosterone levels, or increased estrogen levels. Even erectile dysfunction can cause premature ejaculation. If a medical condition is causing the problem, like acute or chronic prostate inflammation or a hormonal imbalance, treatments are available. In this case, you should see a urologist to find out what specific treatment you need. If you are born with premature ejaculation, there is likely hypersensitivity in the parts of the penis responsible for pleasure and leading to ejaculation, such as the frenulum, corona, and glands. But don't worry, there are also ways to reduce this hypersensitivity so you can feel more comfortable and last longer in any sexual encounter. What can be done to reduce this hypersensitivity? That's the question on your mind right now. So let's start with what may work for most people. 1. Use of condoms. Using a condom reduces penis sensitivity because there's no direct contact. Many people say they last twice as long when using a condom. If you still want to last more than 4 minutes, don't worry. 2. Anesthetic creams or sprays. We doctors use lidocaine to numb areas before sutures. You can find creams or sprays with lidocaine to apply to the glands and underside of the penis, reducing hypersensitivity. Just remember to apply and then clean thoroughly before intercourse so you don't numb your partner and reduce their sensitivity too. 3. Choosing the right position. Position can make a difference. The more friction there is on the underside of the penis, the greater the chance of rapid ejaculation, as that's where most sensory fibers are. Choose a position with less friction on the base. 4. Stop-start technique. It works like this. You go, 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 and when you feel you're about to ejaculate, it's like the light turns red and you stop for 10 to 30 seconds. This allows your body to readjust and you can continue until you feel the reflex again and stop again. This method is ideal with a stable partner and should be discussed beforehand. 5. Medications. There are several medications with different mechanisms of action, but it's best to first work on the points mentioned above in your breathing. You'll likely see good results. All these methods are straightforward and don't require medical procedures. A classic trick many men use is to think of something unrelated to the moment to decrease the reflex, and this also works. That's today's video. If it helped you, leave a like and subscribe to the channel. See you next time.